At ages 65 to 74, about 14.3% of Americans report heart disease, and by 75 and older, that number rises to 24.2%. So when you notice you are getting winded on stairs, needing an extra pillow to sleep, seeing ankle swelling at the end of the day, or feeling a strange new fatigue, that is not something to brush off as just getting older. And if there is new chest pressure, shortness of breath at rest, fainting, a sudden racing heartbeat with dizziness, or stroke symptoms like face droop, arm weakness, or speech trouble, that is not a supplement problem. That is a same-day or emergency problem. What makes this so personal after 60 is that heart trouble does not just show up as a dramatic heart attack. It can creep in as less stamina, less walking tolerance, less confidence leaving the house, less energy to play with grandkids, less sharpness because poor circulation, poor sleep, breathlessness, or an irregular rhythm starts wearing you down. In plain terms, arteries get stiffer and narrower over time, and the heart itself can become weaker or thicker. That raises the risk of chest pain, swelling, shortness of breath, stroke, and loss of independence. For a lot of people, the real fear is not the diagnosis. It is losing the ability to live normally. This gets more common after 60 because the damage is cumulative. Decades of high blood pressure, high LDL, high blood sugar, smoking, poor sleep, inactivity, and excess ultra-processed food add up. Blood vessels lose elasticity. Inflammation and oxidative stress build over time. Women also see risk rise after menopause, and the older you get, the more likely it is that you are taking medications, which means supplements are not just a wellness choice anymore. They can interact, overlap, or create a false sense of safety. Here is the good news. The best supported plan is not a giant shelf of pills. The strongest protection still comes from food quality, movement, blood pressure control, sleep, smoking avoidance, and keeping blood sugar and lipids in range. Supplements can play a role, but for most people they are secondary, targeted, and much narrower than the marketing suggests. If you want the closest thing to a real heart protection stack after 60, start with a Mediterranean and DASH-style pattern. In the PRIDIME trial, adults ages 55 to 80 at high risk who followed a Mediterranean pattern with extra virgin olive oil or mixed nuts had about a 30% lower risk of major cardiovascular events than a control low-fat diet. That is the kind of evidence supplement companies wish they had. And if blood pressure is part of your picture, DASH matters too. In that framework, 1,500 milligrams of sodium per day lowers blood pressure even more than 2,300 milligrams. For many older adults, cutting sodium is one of the fastest wins. Start with extra virgin olive oil. Even at least half a tablespoon a day is associated with benefit in observational data, and Mediterranean trials used it regularly with meals. This is not magic. It is a better fat choice. Olive oil is rich in monounsaturated fats and polyphenols that may help reduce oxidation of LDL, support blood vessel function, and lower inflammation. Drizzle it over tomatoes, lentils, salmon, or steamed broccoli. Use it where you used to use butter or shortening. Then bring in nuts, especially walnuts, almonds, and pistachios. In PRIDIME, the target was 30 grams a day, which is roughly a small handful. Nuts give you unsaturated fats, magnesium, fiber, arginine, and polyphenols that support blood vessels and lipid balance. This is one of the simplest swaps in the world. Instead of reaching for chips or a packaged snack, grab unsalted nuts most days. Beans and lentils deserve more attention than most supplements. Lentils, black beans, chickpeas, and cannellini beans help lower LDL through soluble fiber, improve fullness, and support blood sugar control. They also crowd out processed meats, which is a big win by itself. Add leafy greens and high potassium vegetables like spinach, kale, Swiss chard, broccoli, sweet potatoes, and tomatoes. These foods provide potassium, magnesium, nitrates, fiber, and antioxidants that support blood pressure and blood vessel function. Oats and barley help too, because their soluble fiber can reduce LDL cholesterol. Berries like blueberries, strawberries, and blackberries add polyphenols that may support endothelial function and reduce oxidative stress. And if you tolerate dairy, low-fat yogurt or kefir can fit well into a lower blood pressure eating pattern. Fatty fish is where food and supplements start to overlap. Salmon, sardines, herring, mackerel, anchovies, and trout provide marine omega-3s. The American Heart Association recommendation is 2 servings per week, about 3 ounces cooked per serving. That is a practical target. Fish intake has more consistent support than routine omega-3 supplement use for everyone. In other words, the first omega-3 move is not always a capsule. It may simply be eating fish twice a week. Just as important is what you cut back. Ultra-processed foods, processed meats, high-sodium restaurant meals, canned soups, fast food sandwiches, pizza, packaged desserts, butter-heavy meals, cream-heavy meals, and fried foods all push things in the wrong direction. Higher ultra-processed food intake is linked with higher cardiovascular risk and cardiovascular mortality. So before spending money on the latest heart formula, look honestly at what is happening at breakfast, lunch, dinner, and late at night. A deli sandwich can become salmon and avocado on whole grain. Canned soup can become homemade lentil soup. Salted snack mixes can become unsalted walnuts or almonds. Now, about the supplements that actually matter. Omega-3s are the best known, but the truth is more modest than the label. Overall cardiovascular benefit is mixed. There is stronger evidence in some higher dose prescription settings, but that is not the same thing as saying every fish oil bottle on the shelf protects your heart. Omega-3s may help lower triglycerides and may help selected people, but there are real cautions. Atrial fibrillation and bleeding concerns matter, especially in older adults, and especially if medications are already in the mix. So think food first, and do not assume more is better. CoQ10 is probably the most misunderstood heart supplement. The best evidence is not for blanket prevention in everybody over 60. The most credible use is heart failure support, especially around symptoms and hospitalization outcomes. That means CoQ10 may make sense for a person with diagnosed heart failure who is discussing a plan with their clinician. It does not mean every healthy older adult needs to take it just because the bottle says heart health. Magnesium is important, but again, context matters. It helps support normal rhythm physiology and may help blood pressure modestly. The strongest case for magnesium supplementation is when intake is low or there is a deficiency risk. And many people can move that needle with food first by eating more leafy greens, beans, nuts, and other whole foods, already tied to heart health. Magnesium is not a cure-all for palpitations, and it is not a substitute for getting an irregular heartbeat checked out. Then there is Nattokinase. This is where a lot of supplement talk gets ahead of the evidence. Right now, the evidence is preliminary and not strong enough to present Nattokinase as a proven cardiovascular prevention supplement for the general older adult. On top of that, bleeding and drug interaction concerns are real. So if you are looking for the stack that actually matters, Nattokinase does not belong in the proven category. The real stack is simpler than people want it to be. Extra virgin olive oil, fish twice a week, a small handful of nuts most days, beans and lentils several times a week, more greens, more oats, more berries, less sodium, less processed meat, less ultra-processed food. a 10-minute walk after 1 or 2 meals a day, a goal of 150 minutes of moderate activity a week, 7 to 9 hours of sleep, a home blood pressure check, and enough respect for your body to know that unusual fatigue, new breathlessness, swelling, palpitations, or chest pressure are not things to ignore. If you want one smart move this week, make it this simple. Replace one processed meal with salmon or lentils, add olive oil and a vegetable, walk for 10 minutes after dinner, and check your blood pressure at home. Then look at every supplement bottle you are taking and ask one honest question. Is this solving a real problem, or am I hoping it will cover for habits that need attention first? That is how you protect your heart after 60, with clear eyes and steady daily choices.